I have the privilege and honor to work with Jessica Shore and Junelle Speller, who will be today's speakers. Jessica received her Bachelor's of Science in Nursing from Loyola University of Chicago and practiced at the bedside and medical intensive care unit early in her career. She obtained her PhD from the University of Illinois at Chicago, and her dissertation focused on lifestyle fit to therapy and increasing adherence to pharmacological therapies. She has a background in research administration in large academic medical centers to promote and integrate research within clinical settings with a focus on patient engagement. Jessica currently serves as the Vice President of Clinical Affairs and Quality at the Pulmonary Fibrosis Foundation. She works with the PFF Care Center Network. The CCN, as also known as the Care Center Network, is a group of medical centers dedicated to improving the lives of those living with pulmonary fibrosis. Care centers have expertise in treating adult patients with fibrotic lung diseases and utilizing a multidisciplinary approach to deliver comprehensive patient care, engagement in patient-oriented PF research, and work with the PFF to provide educational materials and engage the local community through PFF programs. Junelle Speller oversees the PFF Registry, which is a portfolio of registries that collects, analyzes, and reports clinical and participant-reported data to advance research on pulmonary fibrosis. She also serves on PFF task forces for our strategic planning and diversity, equity, and inclusion. Junelle brings a unique mix of for and nonprofit healthcare experience, including early work in outcomes improvement policy, and more recent leadership positions in healthcare management consulting, digital solutions, and clinical data registries. She holds an MBA from Kellogg School of Management and a BA in biology from Yale University, serving as an active alumnus to recruit and interview prospective students. Jessica will be discussing research this morning being conducted through the Care Center Network, and Junelle will be giving an overview of research that's happening through the PFF Registry. So with that, I'm going to pass the baton over to Jessica.
Thank you, Scott. I'm so happy to be here with all of you. Thank you to all of our volunteers. We're so excited for you to all be here today. I'd like to set the stage on our medical leadership that we have within the Care Center Network. We draw upon a lot of expertise of the individual care centers, but we also utilize our medical team advisors to help inform the research that we do at the Care Center Network. Dr. Joe Lasky is our Chief Medical Officer, and he still practices medicine at Tulane in the Interstitial Lung Disease or Pulmonary Fibrosis Clinic in Tulane, and he helps advise us on many of our initiatives to making sure that it's relevant and makes sense for the providers at the bedside. I'm also lucky enough within my role here at the PFF to work with our actual team of medical advisors who also works then with Joe Lasky. Dr. Sonia Danoff is actually the senior medical advisor for the Care Center Network, and she's one of the physicians that I work most closely with. She still provides practice medicine at Johns Hopkins in Baltimore. Dr. Joyce Lee is our Senior Medical Advisor for Research and Healthcare Quality, and I'll talk a little bit of how I work with her directly later in the slides. Junelle Speller, who gets to speak after me and really talk about the registry, works really close with Dr. Flaherty, and I'm sure she'll talk a little bit about how they work together, but he's the steering committee chair of the PFF Registry. And then Dr. Amy Case is our Senior Medical Advisor for Education and Awareness and really helps to facilitate our understanding of how best to get to the community on awareness of pulmonary fibrosis and helps out with events such as this. So I think it's really important for our volunteers to understand that we have this great wealth of information from our medical advisors to help us be informed on the state of the science, how are things happening at the bedside, and inform us. So we're really lucky for that. So Scott provided a quick overview of the Care Center Network. And so I wanted to just a couple minutes talk a little bit more about what the actual Care Center Network is. And I usually just call it CCN for our acronym. So the CCN currently has 74 medical centers in the United States. We're focused in the United States, and all those centers have to provide care to adults so they can really improve the lives of those living with pulmonary fibrosis. So we are expanding. So at the end of the month, we will announce that we will be going up from 74. So look out for that announcement. But as Scott talked about, the reason that we are able to designate these specific medical centers as a part of the care center network is that they really utilize this multidisciplinary approach of making sure that care is delivered in a holistic approach for patients. So that means that there is a pulmonologist, sometimes a radiologist who looks at CT scans, a pathologist who looks at potential slides from if someone has a lung biopsy, looks at those slides to understand what are they seeing on that slide after the biopsy is completed, along with other ancillary team members such as nurses, social workers, so that they can all come together and help inform that pulmonologist, the doctor who cares for the lungs, on an accurate and timely diagnosis. So we know that the care providers at the care center network want to make sure that they are engaged in research. So many of our centers are engaged in the new clinical trials that are happening, along with other registry studies as well. And Junelle will be talking about the PFF registry next to inform you a little bit more. And those some of those centers are participating and have participated in the registry. And we want to make sure that the Care Center Network really shares out patient education material, that they have a support group available for their patients. So it's really that whole comprehensive care that's really important. And that's what really brings up the Care Center Network. And then all those individual centers come together to develop that network. And that network, really one of the big goals is to advance research. So when we think about the PFF and the mission, the Care Center Network aligns really well within our mission. And the Care Center Network mission is to propel the field of pulmonary fibrosis through optimizing diagnosis, making sure that care is patient-centered, so the patient's important in everything that those providers do, and that research and education is offered. And our vision is that every patient receives a prompt, accurate diagnosis and receives the highest quality patient-centered care. How do we do that? Well, we broke down some of our strategic goals, and this all comes from the larger PFF strategic goals. So the strategic plan, it helps to inform us to stay focused on getting closer to a cure and staying within our mission. And the CCN has 4 strategic goals: improving the diagnostic process, enhancing quality of care, accelerating research, and effectively advocating for the needs of the pulmonary fibrosis community. This is just a snapshot of the historical perspective of the Care Center Network. In 2000, the PFF was started, and in 2013, there were 9 centers that started the Care Center Network, and that's when it was really coming together to understand what was the goals, the aims of the Care Center Network. And currently, this year in 2023, we're up to 74 centers. We're really excited that our map, we have a lot of coverage here in terms of providers being able to access and treat patients, but we know that there's still more that the Care Center needs to do in regards to having patients be able to access the centers. So I'm here to talk a little bit now more specifically about research and how research happens at the Care Center Network. There's a lot of research that happens across the PFF. We have the PFF scholars. Junelle is going to be talking about the registry. So there's a lot going on at the PFF. And the Care Center Network really focuses on specific items. So I'm going to use the Palliative Care Working Group as an example of how we conduct original research. So the palliative care position statement that was released last October, I can't believe it's already been a year. This was starting of a group that came to the PFF to say there's actual gap. We don't have enough available about palliative care resources. And so co-chairs were identified and were asked to organize a working group to really identify where are those gaps, what could the PFF do to decrease those gaps and address those gaps, were there other education and training materials we could do. And so the first step on most of our projects is to look at the literature, what already exists. And then we determined that there was a survey that needed to be done to really understand across the care center network, how are providers accessing palliative care for their patients? How are they making recommendations for palliative care? And palliative care really is, comfort measures, making sure that we're doing supportive care, making sure that symptoms such as cough are identified as quickly as possible so that patients have, better quality of life. And so that's why it was so important for us to bring this working group together. So after surveying the care center network and bringing that together with all of the known information, the literature, we went ahead and actually wrote different materials up, and I'm going to show that to you. We wrote executive summaries that were directed towards patients and providers on some of the different resources that are available, how to talk to patients, how do patients talk to providers about palliative care. And we were really lucky that once those were released, we were able to have the executive statements really disseminated across the network and more globally across different aspects or networks for patients. For us to be able to then also disseminate that or share it with providers, we went ahead and had results shared at the American Thoracic Society. It's a conference where all of the providers get together to share new information. And so last May and this 2021 and May 2022, we were able to disseminate some of those early results of what we learned during this process. And then I'm happy to report too, we were able to then continue on and do a large manuscript, which is on the right-hand side. Again, understanding we are working on and getting that, not just keeping it at the PFF, but making sure providers more globally are able to access what we learned. So this was just one example of us bringing everyone together to do original research within the Care Center Network. So really doing those surveys. Then thinking about best practices committees. So this is another example of how the Care Center Network brings together folks to do original research to improve patients' lives. So a few years ago, there was a lot of thoughts of, what could the Care Center Network do to address improving the care that's delivered to patients? And, we wanted to first understand, are there differences in ways that the care is delivered across the Care Center Network? So even though these were all expert centers, part of the Care Center Network, how that patient experienced the care and their kind of the process in which they were seen in clinic, those might all have been different. So we wanted to really understand if there were differences. Then we wanted to better understand if those differences actually impacted how patients' outcomes were. Did they live longer? Did they have better outcomes specific to lung transplant? How were the patients feeling? And then when we identified maybe those centers that were providing care that had what we would consider better outcomes, could we learn from those sites? And then could we do anything to measure and really implement those practices across the whole network? And then eventually, thinking more broadly, all centers in the United States. So this is how we broke down our process here. So are there differences in practice patterns across the Care Center Network? And then are those practices and differences really associated with outcomes, the different outcomes for patients? So we actually used the PFF registry data, which Junelle will talk a little bit more about. And we determined that there were differences across the network, that there were different outcomes associated with patients being seen at different centers. We don't know yet if this is good or bad. We just know differences exist, and we want to better understand that. And so what we're working on right now is, can the Care Center Network identify why those differences exist? Could it be geographic? Patients live in a different part of the country, and that's what's contributing to differences on quality of life or access to transplant. And so right now we are really trying to understand that by developing out a research protocol. And Dr. Joyce Lee and the team are working on better understanding that of why do those differences exist and what about particular centers may really drive why those outcomes are different. And then if we could really understand what those practices are that are linked to those differences in outcomes, we might be able to, again, spread them across the whole network or make recommendations formally that providers should be doing A, B, and C. Maybe a referral to a support group is what helps patients have a better outcome. We just don't know at this time. And so that's where we're really trying to understand in this particular research. Again, as we continue to do this work, we are disseminating it, meaning sharing this information across not only just the Care Center Network, but sharing that at those conferences such as the American Thoracic Society. And so in May, we did present that we did identify those differences in patient outcomes across the PFF Care Center Network. And utilizing the registry has been so important for us at the Care Center Network to understand how better we can improve patients' lives. So when we think about how the research at the Care Center Network is directly linked to outcomes as an individual patient, that's really how we try to connect is we're trying to bring it big picture. So are there big differences across the network? How can we narrow it down to identify what those specific practices are? And then again, bringing it back and make recommendations broadly to making sure that everyone has access to what those best practices are. The American Thoracic Society conference every May gives us an avenue or an opportunity to share that information by a poster, talking with other physicians. And then again, we are able to proceed even further and then disseminate that through publications, such as like we did with the palliative care position statement. So when we think about where we're going next with the Care Center Network, we want to continue to facilitate research collaboration across the Care Center Network. We want to develop, where those different gaps exist. So where we still have questions across care, we want to be able to develop working groups to really identify that. And something that's really important that I neglected to share was all of these committees actually have patients and caregivers on and serve on the committee so that we can be informed directly from patients and caregivers on what's important to them. That was critical in our palliative care position statement development, hearing the patient voice and understanding individual patients' perspectives on palliative care, on best practices is really important. And I think that that's where we're a little bit unique at the PFF is that we always are trying to make sure that the patient's voice and caregiver's voice is included in what we're doing. Does it make sense to a patient? And many times the patients provide us just as much meaningful information as we can to them. We want to, and as we continue to build that out, best practices committee is going to be really important. So as we identify that those differences across the care centers exist, we want to really be able to act on that so that we can really help patients all being provided, the best care, and best care meaning having the best outcomes. Some of the other future work that we're working on is developing a position statement on pulmonary hypertension related interstitial lung disease. This is a topic that's come up more recently, pulmonary hypertension and the lack of potential identification of it with patients living with an interstitial lung disease. And so we're looking at that question and how best can we make sure providers know how and when to screen. So there's a lot of information out there and guidelines already, but how do we put it in terms where providers are always able to understand and patients understand what pulmonary hypertension is? The PFF just hosted a webinar on this topic. And so it's something that we want to make sure patients are aware of and how best to get that information disseminated out. So when we look at that position statement, well, most likely what we're doing is developing a survey again to develop questions to ask our care center network. How is the care being delivered at your center? We're also interested in working with other organizations to understand how their care is delivered at different centers outside of the care center network. So we're really excited to continue to contribute to original research at the PFF, and it really complements so much of the other research that's happening, and it's not siloed. We really work across, together. As you could see, the Best Practices Committee utilized registry data to be able to really identify those best practices and if there's differences. So I'm just about finishing up. I wanted to remind you to put questions in the Q&A tab. Junelle and I, along with Scott, will come back together at the end of Junelle's talk, and we will address your questions at that time. I would like to now push it. Well, thank you so much again for all of the volunteers today. We're really excited that you're here, and I want to thank you for letting me share some of the work the CCN is doing. So at this time, I'm going to welcome Junelle Speller to share more about the registry.
All right. Thank you, Jessica. Hi, everyone. I'm Junelle Speller, Vice President of the PFF Registry. Just like Jessica, I work with a number of members across the Pulmonary Fibrosis Foundation and then external to the foundation as well. Internally, we have a small PFF management team, myself, and then my colleague, Misha Kadeh, who's the project manager of the PFF Registry. She just recently joined us earlier this summer, overseeing various aspects, including research, digital content, and participant outreach. We also work with other consultants external to the PFF, a data coordinating center, which oversees the operations, the daily operations of the registry, various consultants in marketing, and others. We also work with a very extensive medical team, including Kevin Flaherty, who Jessica mentioned earlier. He is the chair of the PFF Registry Steering Committee, as well as the Chief Medical Officer, Joe Lasky, the medical team members, and then a slew of others at the Care Center Network sites within our Registry Steering Committee and others. It's a very huge effort, many moving parts, many individuals involved. So the question we often get is, what is a registry? What is the PFF Registry? So before I get into more details about the PFF Registry, I want to just level set and let you know what a registry is. Many of you may already know, but a registry collects information about the health of patients and the care that they receive. As we look at the community registry, we also look at other participants involved in the care of a registry, involved in the care of the patient, including caregivers, family members, and others. The information that is collected from patients is anonymous, or it's limited to protect your privacy. And then all information is stored in a secure database. There are multiple benefits of participating in a registry. First, unlike a clinical trial, we just follow a patient as they go in to receive their usual care at a practice within the hospital, the emergency room. It does not require any additional treatments, any additional medications, or for the individuals to get more medical care. We collect data from different types of patients, from different medical settings and also in different regions. And what we want to do is we want to see significant patterns or trends in the disease course, how a patient responds to drugs and other treatments. And all of the information that we gather from the registry is used to accelerate research and measure and improve the quality of care and outcomes for a patient. So with that, we have the PFF Registry. Now, the PFF Registry, it includes a portfolio, as Scott mentioned, of 2 databases at present. The first is the PFF Patient Registry, which was established in 2016. It collects data from more than 2,000 patients who obtain care at various PFF care centers across the country. The second, which I'll get into a little bit later, is our new and exciting PFF Community Registry, which was just launched in July of 2022, of this year, actually, a few months ago. So what we're doing with the Community Registry is obtaining information from patients and then gathering additional information from caregivers, family members, And new and exciting for us is tracking the care of lung transplant patients who have had PF or ILD. Combined, these two databases provide a wealth of information on pulmonary fibrosis and interstitial lung disease to really accelerate and support research to improve care and outcomes. Now, before I get into the details of the registries themselves, we talked about the what, the definition. I want to talk about how we got here. So right here, we have a timeline of the registry. I mentioned to you when we launched, there were some years prior, and on my timeline here, I have 2013, but really we started over 10 years ago looking at conceptualizing a registry. We realized that this was a rare disease. We didn't have much information within our research, and we had a lot of questions that we wanted to answer. So about 10 years ago, PFF staff, researchers, pulmonologists, and others started to talk about developing this large-scale research initiative across multiple medical centers to collect the data from patients diagnosed with PF or ILD. The data would be collected in a naturalistic manner, as I mentioned earlier, by following the patient's ongoing care and help to support research and contribute to the development of new therapies. The early team saw the benefits of registries in advancing research for other diseases, particularly rare diseases like cystic fibrosis. So they thought this would be beneficial for pulmonary fibrosis as well. So for several years, the foundation conceptualized and developed the patient registry. And in March of 2016, we enrolled our first patient in the registry. And by June of 2018, we had enrolled just over 2,000 patients. Researchers submitted proposals for review and approval in order to analyze the data. Then they presented their findings at various conferences. And you can see this across the timeline here, where we submitted abstracts to the American Thoracic Society conferences, the PFF summits. We've also published recently, but I'll get into a bit more detail here. So that's how we arrived at the registry. So I mentioned the patient registry, which has been around since 2016. We have a little bit more than 2,000 patients enrolled in that registry. And you can see here on the map, at the time, we have 42 PFF care centers. So that's a testament to Jessica's work since she's joined the foundation in really growing and building the care center network. So at the time, we enrolled the 2,000 patients across 42 centers in 26 states across the US. And we amassed a lot of data. So, people's information is going in. People also want to know what's coming out. So we had a little bit more than 60% patients diagnosed with IPF, and then other PF and ILD diagnoses as well, as you see here. We collected a ton of data. So one thing that we did was requested consent to get a blood collection, a blood sample at enrollment for patients who were part of the patient registry. We also gathered HRCT scans for those individuals involved in the registry. We amassed data for clinic visits, DLCO measures, lung volumes, and more. So who was in the registry? We had predominantly males involved in the registry. Many were on antifibrotic treatments, such as nintedanib and pirfenidone. And then at this time, we have a little bit less than 35% who are still involved in the registry. So the outcomes of all that data is that it fed into various research initiatives. You can see a smattering here of some of the publications that have come out of the registry, including a publication earlier this year looking at the association between anticoagulation and survival in interstitial lung disease. And then most recently, we had a study published in October, just last month. It's November already, just last month in JAMA, the Journal of the American Medical Association, where we looked at how air quality affected the progression of individuals diagnosed with pulmonary fibrosis and ILD. So pretty significant work has gone in to the registry, and then a lot of really great research has come out. So looking ahead, we've done really great work with the patient registry. We recognize that the patient registry was limited. We only had 2,000 patients in it, and we know that over 250,000 individuals are affected by PF and ILD. So we wanted to have a more robust registry aligning with our existing patient registry to go into the community, those individuals who do not get care within the care center network, or who do, those individuals who also get care within community settings, rural healthcare and others, and non-CCN academic centers could participate by inputting their information directly into the registry, the community registry. We also expanded to include lung transplant recipients, caregivers, and family members, recognizing the importance of those individuals in contributing to the care and outcomes of patients. So as I mentioned, we expanded to include patients, lung transplant recipients, caregivers, and family members across the United States in various regions and healthcare settings. We wanted to create a more robust source of information to help researchers find answers to help diagnose, treat, and potentially cure pulmonary fibrosis and ILD. We want to provide this data set to help researchers also improve the quality of care provided in practices across the country. As Jessica mentioned, the data that we've been using from the patient registry has been helping to provide benchmark information and how we can improve the care at our current practices. That information from the community registry will also be used to support legislative and other advocacy efforts. And then more importantly for us, we want to really engage and unify and energize the community all around the same goal to improve care and outcomes for patients affected by these diseases. So the community registry, we talked a little bit about the why. Certainly we want more data points to help accelerate research, but I want to get into a little bit more details about the how. What is required of you? So first of all, we want to encourage you to enroll. There's a join button on our pffregistry.org website, and I'll provide that information at the end of my talk here. But once you get in and do the screening form, complete the informed consent, there are various surveys that we ask you to complete. Only 2 hours per year, all of this data will feed into accelerating research. So we want you to provide the data through the secure, easy to use online portal every 6 months. There are surveys at the beginning. The enrollment survey takes about 45 to 60 minutes for the initial enrollment survey. And then 6 months thereafter, you'll receive a follow-up survey where you'll be asked how you're doing. Has anything changed? Do you have new medications? Have you been to the hospital? And then we're also looking to develop optional sub-studies on specific topics. So we'll look at various groups within the community registry, perhaps those who have had military experience, some of our veterans, or those who have had specific diagnoses such as hypersensitivity pneumonitis, exposure-related diseases. We want to also look at oxygen use. So basically 2 hours per year of your time, about an hour for the enrollment survey, and probably less than an hour for the follow-up surveys to complete would really be beneficial in accelerating research for these diseases. So what kind of information is asked? We're asking information about demographics. So, who are you, where you live, date of birth, your diagnosis, your medical history, what kind of medications you're taking, also your exposures. Perhaps you've smoked or worked in a particular industry. We also want to ask about your family history, your education and employment. A lot of questions certainly, but all of this information will be valuable to accelerate research for pulmonary fibrosis and ILD. So typically when there are registries, we ask a lot of questions, and we realize that patients want to know what's happening to my data. So I showed you earlier from the patient registry, tons of research has come out. Instead of waiting to just update you on the research, we want to provide periodic updates. Every month, you'll receive an electronic update via email to update you on enrollment figures, the latest research, and other information. And then twice a year, we'll provide a more extensive coverage within an e-newsletter to you as well. So at this point, we have almost 700 individuals who have enrolled in the registry. So we're excited about that, but of course we want to grow. We know that there are tens of thousands of individuals affected by this disease. So we want to make sure that we have as many points of data, as many individuals who are participating in the community registry, again, to accelerate research. So here are some of the benefits of the community registry. The information I've said repeatedly will help to accelerate medical research, to reduce the time to diagnosis, develop new treatments, and improve care and outcomes. I also want to point out that this is the first registry for lung transplant recipients who have had PF or ILD. So we know that there are various transplant registries, lung transplant registries, but this is focused on those who have had PF or ILD. We want to continue to track your care and outcomes, see what unique patterns that we can see reveal for those recipients of lung transplants. We're also looking to capture information for caregivers and family members to assess the full impact of PF and ILD. And again, we're hoping to foster a community of patients, lung transplant recipients, caregivers, family members, healthcare providers, all of those individuals involved in the care of patients with PF and ILD, all with the same goal: faster and more accurate diagnoses, better treatments, and hopefully a cure. So tons of information that I've provided you with. I hope it's clear that the registry is vital in accelerating medical research for PF and ILD. So what can you do next? First, it would be great if you could visit the PFF registry website. In the upper right corner, you'll see a huge green button that says Join the PFF Community Registry. From there, you will be taken to a site to complete your screening form and then your informed consent forms. Once that is completed, you will begin the initial survey, the initial enrollment survey, to upload your information, your demographics, your medical history, and so forth, via that secure online portal. So then within 6 months later, you'll receive a new survey, the follow-up survey, to see how you're doing, if anything has changed. I also talked about the updates that you'll receive every month, an email, and then the twice annual newsletter. And then the final thing, we hope that you spread the word to other patients, others who've received a lung transplant, caregivers and family members, to encourage them to join the community registry.
Great, thanks, Janelle. So this is going to be a CCN question first here. Jessica, how do centers apply to be a member of the Care Center Network?
Oh, Scott, great question. So about every year, the PFF opens up a call for proposals or applications, and centers can apply at that time. It's a formalized process in which there are specific questions the center needs to address, and that really shows us at the PFF their ability to meet the criteria that the steering committee and the PFF leadership has identified as what makes a care center network. And so centers are able to apply about annually. We had 2 cycles this year because we were catching up a bit from the pandemic, but we anticipate in 2023 there being 1 cycle where providers are able to apply formally as a Care Center Network member.
Great, thank you. Follow-up question to that. How do I find a Care Center Network site?
Wonderful. Well, the PFF website, pulmonaryfibrosis.org, has a Find Medical Care app. It also similarly has a Find Support Group app. So within our website, you can go ahead and put your zip code, or you can let it identify where you are. So, you know, when you're on the web, sometimes it says your browser wants to see where your location is. That's why. So it uses your zip code and where you are to identify the nearest care center in your area. And so Find Medical Care is a tool we have have on our website that can help find the current care centers and the closest one to home. There's also a full listing of all Care Center Network sites on our webpage.
Great, thank you. Junelle, this is for you. How do I know if I'm in the registry?
So there are two registries, as I mentioned. There's the patient registry, which is fielded through the Care Center Network sites, and then the new community registry. So for the patient registry, typically a patient will go through their physician or a nurse or a clinical research coordinator, and you'll complete a consent form. So it's at that time you will know that you're in the patient registry. For the community registry, we are getting individuals to enroll online, and you'll receive confirmation via email that you are in the community registry. From there, you'll get even more confirmation, as I stated, with email updates and then biannual newsletters that will provide further information about how the registry is doing, how many others have enrolled, and other information as well.
Great, thank you. I think you've already answered this, but there was a question posed. Can I participate in both the patient registry and the community registry?
Yes, absolutely. So actually, patients who are in the patient registry are required to also be in the community registry. We want to see the difference between what's provided from their physicians and then how patients perceive their care. So both of those perspectives are vital. That will be also enormously valuable for our researchers as well. So definitely both registries, we want you to participate in them.
Fantastic. Jessica, this is another CCN question. If someone is not receiving their care at a large academic medical center, how can their physician or their care team benefit from engagement with the Care Center Network?
Yeah, great question. So we recognize that the Care Center Network will most likely never be able to cover every pulmonologist in the United States. That's just such a broad group of providers, but we are actually developing an associate membership or kind of a tiered approach to the Care Center Network, where we will allow and welcome additional providers who may not fit our full criteria. We know that there's some providers who aren't able to have all that criteria. They just won't ever have all of those resources that we say are required to become part of the Care Center Network. So we're in the process right now to understand what are really those core and most important parts. And then those providers who meet that new revised criteria can join the network and interact with the full Care Center Network and really inform us at the PFF and the broader network how care is delivered potentially in the community. Additionally, providers are able to attend our PFF Summit every other year and engage with the Care Center Network there. And so there's a huge amount of ways that providers are able to interact with the Care Center Network, even if their individual center is not part of the network formally. And that's an area that we're really serious about continuing to expand and have opportunities for providers to be more engaged with the network.
Great. There's a question specific to the palliative care statement. So what kind of information is contained within that statement?
Sure. So moving forward, we're trying to have position statements in general, have one that's provided for directed towards healthcare providers and one directed towards patients. So the one that's directed towards patients really is a resource and really is provided the different resources that are available on website, also set up, it's set up as a Q&A, questions and answers. So how do I bring up palliative care to my provider? Where can I find palliative care? And it also helps to define specifically what palliative care is. Again, there's a lot of confusion about palliative care and hospice being the same thing, where palliative care is really about making sure that quality of life is addressed and that there's symptom management. And hospice is really more towards those last months of life. So we really wanted to make sure that any misconceptions about palliative care are kind of addressed head on there, and really promoting the benefits of palliative care early in diagnosis with pulmonary fibrosis. So that's really where the patient facing is, and the provider facing gives tips and tricks on how do you talk about palliative care to your patients, and also resources for providers.
Great. And since we're speaking with our volunteer group this morning, the question was raised, do you need more patient volunteers to work on any of the position statements on PH-related ILD? And if so, who should that person contact?
Sure. If there's anyone who's interested in, giving time and volunteering and participating, we love it. So an easy way to get in touch with us is ccn at pulmonaryfibrosis.org, or you can contact the programs team and they'll get you in contact. So someone like Kate Gates or Ephraim, any of the contacts you have at the PFF will be able to direct you to our team.
Thank you. Junelle, this is a question for you. It's fairly broad, so I'm going to narrow it just slightly, but then you can expand on the broad nature of it. The person's asking what types of studies have been done through the registry. And so I recognize that there's a lot of different types of studies. So I'm going to ask you directly to zero in on, first of all, the Prolific Consortium, if you wouldn't mind speaking to that a little bit.
Sure. So the Prolific Consortium is utilizing registry data. As I mentioned, a lot of research, wonderful research has come out of the registry. But the Prolific Consortium is a group of pharmaceutical companies, over 12 pharmaceutical companies, as well as the Pulmonary Fibrosis Foundation and Three Lakes Foundation, who are looking to address whether specific individuals with a specific gene variant respond to, wrong study, precisions. We have tons of studies, as I mentioned, but the Prolific Consortium is looking at developing biomarkers that can be used as a foundation for developing new treatments for individuals with pulmonary fibrosis and ILD. So as I mentioned, there are over 12 pharmaceutical companies involved in that effort, as well as the PFF and Three Lakes. They right now are looking at the blood samples that were collected as part of the patient registry as the basis for developing those biomarkers. We're hoping that will branch off and it'll be an iterative process where they can develop new and better treatments for those with the diseases.
Fantastic. Staying in the research realm here again, Jessica, this is a question for me, of course, since I'm aware of this, but could you speak a little bit about the effort amongst all of the Care Center Network sites to create a registry of research that had been conducted at those centers that had been, somewhat housed within each center, but not available across the network, and what you're doing along with others to make sure that all of that information that's been collected from patients in prior studies can be maximized for use amongst other researchers?
Sure. Yeah, Scott, that's a great question. We went ahead and, to be able to really get collaboration across the Care Center Network, we were trying to think of ways to do that without, being able to utilize existing data. So things that already existing in local centers and their research kind of registries. So similar like the registry here at the PFF, where centers contribute more broadly to a larger registry. Many centers have their own local registry and they collect all different things. Sometimes blood samples, lung tissue, information on how the patient's feeling, quality of life, such as a patient-reported outcome survey. All of this different data is collected at individual centers. And typically it stays at those centers, and those physicians and care teams there, researchers are able to use that data there locally. But what we wanted to do was find a way to bring all of those local smaller registries together. So all of those data houses basically together under one umbrella. And so we're working on developing, Aubrey and Ingrid on my team are working on developing out kind of a dashboard. And what we envision is that centers could put what they have at their local center, what are they looking to collaborate on, and every center coming together to do that, we'd actually be able to match the centers together who are looking for similar items to make their data even larger. Lots of times to be able to make suggestions and use statistics, so you need a larger number of patients or samples to be able to make those kind of generalized assumptions, or see if your hypothesis, your research question can be answered. You need more than just you have locally at your own center. So we're hoping that if we bring all those centers together, marry kind of together, matching them, I think of it almost as a dating site, right? Like you're looking for 5 samples and I'm looking for 5 samples. We are looking at the same thing. We're going to bring them together, and the PFF is going to be that matchmaking group. And hopefully then research can, continue to contribute and not just stay locally at the centers.
Yeah, I think the really exciting piece of that is that patients have already contributed their information for those existing studies, and it's an opportunity to maximize the use of that and not just kind of a one use and be done. This next question, I'm going to go ahead and answer. It's a tech question. Who do I contact for technical help with the registry website? That is registry@pulmonaryfibrosis.org. Again, that email address is registry@pulmonaryfibrosis.org. Okay, so we have a few more minutes for questions. So this one would be, what advantage would it be to transfer my care from my current pulmonologist to one at a CCN site that was recently designated within my city?
Yeah, great question. First and foremost, we would never make a recommendation for you to transfer your care at a pulmonologist that you are happy with, you're receiving the care, and that you really connected well with. We would never make the recommendation for you just to change based on our designation. But what I would say is that it's always good for you whenever you're receiving care from a provider to make sure it's a good fit. And I would say that if it's not a good fit for you, then you might want to consider looking at providers in your area that might be a better fit. But we would never make a recommendation for you to transfer care. And many times the pulmonologists in a city all work together in many ways behind the scenes in providing care to patients. So that's really a question for everyone to ask themselves if they're really satisfied. Are they getting what they need from their current provider? And if you are, that's great. If you have specific questions about your care, I would recommend you talk to your provider directly about that. If you're not satisfied with those answers, maybe that's when you want to consider, not just transferring, but maybe a second opinion or something like that. But again, we'd never recommend just to change because of the designation.
Yeah, I think it's important for people to note that although participants in the Care Center Network, their sites have gone through a scrutiny to ensure that they have a number of different elements in providing high quality care to patients and participating in research. It doesn't mean that there are people out there practicing outside of the Care Center Network that cannot deliver very high quality health care. They just may not be in an infrastructure that has all of these other elements. So I would not want people to walk away from this conversation and think that they're getting a substandard quality of care if they're not being seen at a CCN site.
Absolutely, Scott. And if I could add, that's why that disseminating the research that the Care Center Network does is so important, so that it can reach all of the providers, so that physicians can access that, nurse practitioners can access the research that we've conducted.
Right, and I think that also ties, we only have about a minute left, so I won't pose any more questions, but I'm going to comment, this relates to Junelle's efforts in launching the community registry. We know that if you're not being seen at a CCN site that was participating in the patient registry, that by doing this expansion, those who aren't being seen at a CCN site now have the ability to participate. So Junelle, we only have about 30 seconds or so. Could you just comment briefly on that?
Yeah, so that was the impetus for why we wanted to move beyond just the care center network. We wanted to get other patients who receive care outside of the care center network. As Scott mentioned, there's high quality care being provided outside of the CCN network. So we are expanding that network to get as many patients, as many voices, data points, as Jessica mentioned. The more data we have from different individuals, the more we can really accelerate that research. Thank you. Looks like we don't have any more time left.
Fantastic. Well, thanks to both of you, Jessica and Janelle, for talking with the group today. These are both really important programs at the PFF. I've been around long enough that they didn't exist when I started, and so for me personally, it's very exciting. Not only that we launched them, but they've been so successful. And I know it's taken many people to make them effective, but your leadership has been critical. So thank you.